Rhinoplasty is a major focus at Smith Facial Plastics. I've probably performed 2,000 or more nasal surgeries to date. And we perform nasal surgery for many different reasons. Often it's for aesthetic reasons, often it's for functional reasons, improving the nasal airway, and a lot of times it's repairing injuries from dog bites or defects created by skin cancer. One of the tools I routinely use, especially when somebody has aesthetic goals, is the Vectra 3-dimensional imager. And so you can see we've got this very, very sophisticated software which helps us to get on the same page with each and every one of our patients. It helps me put together a very precise surgical plan and allows me to educate the patient with regards to realistic expectations. So this is an example of a patient I took care of a couple months ago, and at initial consult we analyzed the nose. You gotta ignore some of the digital artifact there, but you can see this is a young lady who is, she's got a prominent dorsum. Her projection is pretty reasonable. She doesn't have a lot of harmony between the ala and the columella, so the proposed changes equate to a more refined dorsum, a very subtle supertip break, and a little bit more harmony between the ala and the columella. That also equates to changes on the anterior posterior view, and you can see it equates to some refinement of the nasal tip and the dorsum. The neat thing about this program as well is that we're able to compare these images. We can rotate the images and help get feedback from the patient so that we are really honing in on their specific goals. So let's take a look at that same patient 6 days after surgery. You can see that there's a minimal amount of swelling. There is some with regards to around the eyes. There's certainly significant swelling of the nose itself, as that's where we operated. There's not a trace of bruising even at day 6, and you can see that there's refinement of the nasal tip. Let's take a look at the profile. You can see some of the goals with regards to the dorsal convexity have been markedly improved. We have an improved relationship between the ala and the columella, and this is all at day 6 where things are quite swollen. So this very nice young lady also gave us permission to use her photographs. You can see at a month some of that swelling is starting to dissipate. I think it's a real game changer and enhances the natural, beautiful features of her face otherwise. And on frontal view, you can see there's some refinement of the tip. There's very, very nice dorsal aesthetic lines, much more balance between the tip and the ala. And then this is also a great view to look at it. It's, I would call this a game-changing aesthetic result. What should we expect over the course of a year? We'll have further refinement and reduction of swelling.